Life-saving medication and equipment are running at critical levels in hospitals and clinics across Port-au-Prince as violent gangs strengthen their hold on the capital and beyond. Even in critical cases, patients are finding it difficult to reach the hospital.
We received, for example, around 700 patients last month in the emergency department, and about 10% of those were wounded by bullets. What we see is that people have great difficulties getting to the hospital when they're wounded. People are often arriving late because the situation is simply too dangerous for them to come to the hospital, and that makes it much more difficult to treat their wounds.
Jean-Marc was shuffled into the emergency room with a thick and bloody bandage on his right hand. He was shot in the streets.
I did not see the police armored vehicle in the street when I was crossing. I saw that the other person just kept on walking, but when I turned my head, I heard gunshots coming from the armored car. So I hit the ground with my hand covering my head, and when I saw all the blood, I thought I was going to die.
Dunais Flerimons had to scramble to find medical care for his son.
He has had a fever for almost 10 days. He suffers from sickle cell disease and malaria. The doctors saw him, but I still don't know what is going to be done next.
The spiraling chaos has left a growing number of patients with cancer and other serious illnesses with little to no recourse. Haiti has been no stranger to unrest and political instability for the last 2 decades, which saw also 2 major earthquakes hitting the country. The recent wave of violence flared up in late February when Haiti's prime minister announced the long-awaited election date as not until mid-2025, pushing the country's already fragile health system to brink. Kubra Akkoc, TRT World.